A child and adolescent psychiatrist who spent almost 2 years on Nauru working with refugee children says he's tried to talk to the Prime Minister in advance of her visit there but received no reply. Jacinda Ardern will join the Australian Prime Minister and Pacific Island leaders on Nauru next week. She's under growing pressure to resettle refugee children detained there as part of Australia's controversial offshore detention program in New Zealand. Dr. Vernon Reynolds, a New Zealander now based in Canada, provided psychiatric care for the children, working for International Health and Medical Services, who are contracted by Australia's Department of Home Affairs under Peter Dutton. Of course, he's treated dozens of children on Nauru, and after increasingly vocal criticism of their condition and continued detention, has been told he can't return. He believes the Prime Minister will not be shown the full picture when she's on Nauru, and says she needs to know what the reality is.
I've been waiting for our dear Prime Minister to contact me to give her some of my thoughts. I've certainly offered that invitation to her. I'm really pleased she's going there. I think it's a great opportunity for her and New Zealand to speak out on these issues. I think we have to speak strongly that this is an intolerable situation which has a political solution, and that is really the only solution that these children have. We can offer them a home, and I know New Zealand's already offered to take 150 people from Nauru, and Australia has declined. We can put pressure on Australia to make that happen, and I think we should. We can speak out loudly. We can speak out in the UN. We can use whatever means to give these innocent and vulnerable children a voice, which they have not had up to date.
So you say you've reached out to the Prime Minister. How have you done that?
I've sent her a letter through the email channels that the Parliament and Labour Party offer, but unfortunately I've not heard anything back yet.
Dr. Reynolds is a child and adolescent psychiatrist. Is this an appropriate place for children to be?
Not at all. Not at all. I mean, it is a toxic environment to grow in, and I'm sure it has damaging effects on all of the kids. And I guess the more vulnerable are the ones that we've seen, or the ones where the families were disrupted for various reasons. So, yeah, these kids need to get off that island. They need to be put into an environment where they are able to be children and supported to have healthy experiences and a caring environment, and that's just not possible in Nauru, not for this cohort.
Dr. Reynolds, can you tell me what you saw most often as a child and adolescent psychiatrist working with these children and young people? What was it that you were treating?
So the majority of issues were trauma-related issues. Most of these kids have had various traumas, whether it be the initial trip in their attempt to get to Australia and the boats that they took, the experiences that they've had through the detention process, which is a paramilitary prison-like process, and then the experiences they've had while on Nauru, living in prison-like camps for several years and living in a community where they're really not, and a lot of them have been subjected to various degrees of bullying and harassment. So lots of anxiety problems, lots of post-traumatic stress concerns, lots of depression, lots of self-harm and suicidal thinking and behaviour, and for some extreme withdrawal type reactions where they basically curl up in bed and give up on life really and go into a semi-comatose state, which I guess has become known as resignation syndrome. So I would say you're looking at near on 50% of the children in that situation have had serious mental health concerns.
And when the cause of those mental health concerns is significantly environmental and you can't remove the children from the environment, how do you treat them? Well,
you're a little bit, tied by what you can do. And as you say, the main cause of these illnesses is the environment, which is quite toxic to both their physical and mental well-being, as well as healthy development for any child. So we were able to offer a degree of support, some counselling and psychological work around managing stress and anxiety and emotions. We were able to offer some parenting support, and I guess what happens in these environments is parents become paralysed, they become unwell themselves, and their ability to provide, effective parenting to their kids deteriorates. So there was a lot of work around trying to support parents to actually actively parent. Some of the sickest children I saw, were young girls who were, for various reasons, frustrated by their powerlessness in life, and such things as family separation that the Immigration Department basically caused, and leaving a young girl separated from one of her parents, and then the young girl crawling into bed and shutting down, and doing that for months, and myself voicing that this is completely inhumane, that the cure to this young girl's distress is to reunite her family, and being told that that's not a valid argument, and having to watch this girl every time I visited deteriorate further before my eyes. That sort of stuff is unbelievable, and constantly sending more and stronger messages to the channels that are open to you as a doctor in Nauru, and having that fall on deaf ears, it's absolutely absurd and immoral.
Dr. Vernon Reynolds, who is a child and adolescent psychiatrist who worked on Nauru. We've just received an email from the Prime Minister's office about Dr. Reynolds' invitation to brief the Prime Minister on what's taking place on Nauru. The email says, and I quote, "Yes, the Prime Minister has received an email from Dr. Reynolds and she's preparing a reply. She doesn't need a briefing from him. Many thanks."